Welcome to the Met Show. I'm Dr. Rami Albahri, your host today. At the Met Show, we dive into the stories, research, and expertise of extraordinary people in medicine, entrepreneurship, and dentistry. Our goal is to transform their insight into practical tips that will make a real difference in your life and the lives of those around you. Through conversations with a diverse range of experts, from physicians and dentists to researchers and CEOs, our mission is to help you become more informed and a sharper, critical thinker. In today's episode, we have Dr. Yasmin Chebbi, a Harvard graduate and an American board-certified sleep dentistry expert and an author. Thank you for coming on our show today.
Thanks for having me. Good, thank you.
How's your morning so far?
So far, so good. Excited
Awesome.
to dive in.
Yeah, I'm excited to have this conversation. So tell me a little bit about yourself and your background, your education.
Yeah, sure. So I was trained at Harvard School of Dental Medicine. I was there for my pre-doctorate program. Graduated almost 10 years ago and practiced a bit in the US and now practicing here in Abu Dhabi.
All right, wow, that's pretty incredible. Let's talk a little bit about you practicing in the US. I think a lot of people, being that we're living in Abu Dhabi, people don't understand what it takes to be licensed in the US. Can we just talk just a little bit about what it took for you to get that license in the CDCA?
Sure. So when I was going to school, the requirements were, of course, very stringent. To get into dental school, there's a lot that goes into it with applications, taking an entrance exam, and having a full, complete application. But once we get licensed, some of the hard parts about the dental school licensure is the live patient exam, which can be very tricky because you're working on a real person as an exam. So the pressure is already very high, but you have to find that patient yourself, and the requirements are very specific. Your cavity has to be a certain size, it has to be on a specific tooth, and you really hope that your patient is going to show up that day at 8 a.m. and help you to pass this exam.
Absolutely, this is exactly my experience. When I was taking that exam, I actually had my friend rent a car, and he went and picked up, we were living in New York City. Right?
Yes.
And he went to Brooklyn, picked up a patient, dropped him off at NYU, and then drove up to Queens, and then picked up my other patient, drove him down, and we had to do this for each other because if the patient doesn't show up, we fail.
That's right.
It's absolutely ridiculous.
A lot of students had to pay for hotel rooms, pay the patient as incentives to come, pay backup patients just in case.
Exactly.
Thankfully, I think they're trying to find a different model than live patient exam.
I heard COVID had made that happen.
Yes.
Okay. How about Harvard? Harvard's extremely unique. It's unique in its style and it's unique in its history, being one of the first dental schools in the world.
Yes.
And so how was your experience there? Walk me through your years there.
Sure. I loved my time at Harvard. I really feel like I grew a lot as a person and as a clinician. One of the unique aspects of Harvard is that for the first 2 years, the dental students and the medical students are taking the same classes. So we are in anatomy together, pathology together, we're learning about lungs and heart together, and we even interview patients in hospitals and take new patient exams, learn how to do an intake for patients. It's only in years 3 and 4 that we go into the dental clinics and the medical students go into the hospitals. And that really gave us a grand appreciation of the body as a whole and learning to treat the mouth in the lens or in the context of the whole person.
Right, absolutely. And I feel like that's one of my biggest struggles in practicing in the UAE is when even patients find that really weird. Whenever I'm asking them a medical question, they'd be like, what does that have to do with this? Like, I just want my tooth fixed. I'm like, everything is interconnected.
Right.
Like if you have perio disease, that affects your heart.
Right.
Do you know that? And they're like, no, like it's unrelated. What are you talking about? Just fix my tooth.
Right. There's a very one of the bacteria that we find in gum disease, P. gingivalis. They have found that same bacteria in the brains of Alzheimer's patients.
Right,
so untreated periodontal disease, could travel up to the brain and cause issues.
Absolutely. And I guess that's what's so unique about Harvard is that you get the best of both worlds. You become a dental clinician along with that massive background in medicine.
Definitely.
So tell me a little bit about your book. You're a published author.
Yes.
Tell me, what is it called?
Yes, so my book is called Eat, Sleep, Breathe, Oral Health, Why the Mouth Matters. And it's exactly what we're talking about. Really the context of putting the mouth back into the body and understanding how the mouth is important for eating, for sleeping, and for breathing.
Absolutely. Talking about breathing, well, you are board certified in sleep dentistry. What was that process like?
Yeah.
And was that after dental school?
Yes, basically all of my sleep apnea training happened after dental school. We weren't really exposed to it in our curriculum at that time. It wasn't as common as part of a curriculum. But what does it entail to become a board certified dental sleep medicine Diplomate is there was a test that we took, at a testing center. There are mastery classes that one has to take and be proficient in, and there are also cases that we have to complete and present to the board with success.
Wow. So sleep apnea. Tell me a little bit about that, if you can briefly explain what that is.
Sure. So in very short terms, sleep apnea is when you stop breathing at night. And your body wakes up from that in an attempt to save you from not being able to breathe. A little bit of the longer version of that is there are different reasons why our body may not be breathing at night. It could be anatomical, so the back of your throat closes. It could be more cerebral, where the messages aren't getting sent. But for the most part, sleep apnea happens around the mouth area, where the tongue falls to the back of the throat and closes that space, causing us to not be able to breathe. The flow of air stops, and we wake up again, and that is our apnea.
It's making me want to breathe right now.
Right, that's right. Taking nice deep breaths.
All right, so what are some symptoms that let's say somebody watching this will be like, okay, wait, that sounds like me. Well, what are some things that you can keep an eye out for?
Sure. The most common or biggest red flag that people with sleep apnea may have is snoring. So snoring is turbulent airflow, and as you're snoring, that means that throat area is getting shorter, smaller and smaller, which could lead to an apnea, eventually a closing and an opening again. So if you're snoring, that's definitely something you want to look into. If you feel like you wake up often at night, if you wake up unrefreshed, if you have high blood pressure that can't be controlled by medicine, if you have cardiac arrhythmias, and really anything that could be associated with poor sleep, anxiety, depression, weight gain, falling asleep at the wheel. If you're not getting good sleep at night, it's definitely worth looking into sleep apnea as a possible cause.
Wow, it's a lot of things. So what are some risk factors that people have that could cause them to have sleep apnea?
Sure. So in the past, we've always thought about the old fat man. So in traditional questionnaires, we look at if you are male, you're more likely to have sleep apnea, if you are overweight, and if you are above the age of 50. But really, when we're looking at it now, there could be a lot more things involved. Definitely weight is a big factor, because the more fatty deposits you have in your throat, the smaller your airway could be. But we're also looking in general, is the mouth small? Is the general space behind the tongue smaller, which could make it more likely for it to close and have an apnea?
And that could happen to adults and children alike, right?
Yes, definitely. Anyone whose anatomy might be compromised a little bit smaller is at risk for sleep apnea.
Absolutely. And so how does that affect the oral health? So when we're talking about somebody who's got sleep apnea, does that actually affect the oral health and overall well-being, or is it just this sleep or neurological issue?
Sure. So, definitely has a lot of overall health consequences, as mentioned before, in terms of like those symptoms to look out for. In terms of the mouth, there's a lot of signs of sleep apnea or possible sleep disordered breathing in the mouth. It's always a part of my exam where I can kind of guess if a patient is snoring just by looking at their mouth.
Well, what do you see?
For example, we might see worn teeth, so grinding of teeth. We might see inflammation in the front of the gums, which means that they're breathing through their mouth. We might see these small bones under the tongue called tori, which basically means we're grinding really hard. It's like you're giving a workout to those bones and they're getting bigger. We might see wear facets from acid, sometimes having sleep apnea, and that internal negative pressure can cause acid to sit on the teeth.
Reflux.
Like reflux, exactly. There's a lot of different signs there. We look at the tongue. If the tongue kind of looks scalloped, which means it doesn't have a lot of room, it's being caged in by the teeth, that's also a sign that you might have sleep apnea.
Yeah, I have that.
It's very common, but doesn't mean you have apnea. These are just risk factors that we look at.
I always look at my tongue, I'm like, why does it look that way? It looks exactly like my teeth.
Yeah, right. It's sitting in that house.
I do grind my teeth, unfortunately. So what are some treatment options when we're talking for these dental conditions?
Sure. So if somebody has already been diagnosed with sleep apnea, there are a couple different ways that we can treat it or manage it. The traditional way in the medical world is using a CPAP machine. That's kind of basically, if you think about your throat like a floppy tent, the CPAP machine is blowing air to keep that tent open. Another way that we can help with that is an oral appliance. That's really where a dentist comes in. What an oral appliance does is it moves your jaw just a little bit more forward to get that tongue out of the way, because the tongue is connected to the jaw. And like I mentioned before, most sleep apneas happen because that tongue slides to the back of the throat. So if we can get everything a little bit more forward, we have air in the back to breathe.
All right. And that's made in the laboratory. How is that appliance made?
Sure. So after doing a full exam, a sleep certified dentist would take personalized molds or impressions of your teeth and find a proper position for you about where you would be so that you're not snoring. And then yes, it's made in a lab and titrated or adjusted in the dental office.
Okay. What would you do in a scenario where they've got sleep apnea but they also have bruxism? Would you give them an oral appliance for bruxism, or would you give them a mandibular advancement device?
I'm always focusing on root cause. So we want to know the real reason why somebody's having an issue. Often grinding of teeth is a symptom of sleep apnea. So definitely want to treat the bigger health concern, which is the sleep apnea.
Got it. Okay, and I'm assuming one of the big factors of success in these treatments is patient compliance.
Definitely.
How do you assess that?
Yes. With a CPAP machine, it's much easier to assess compliance because the machine can tell you if it's worn or not worn. With oral appliance, a little bit tricky. We really have to base it on patient trust and patient history that they're telling us that they're wearing it. In the end, it's really for their benefit. But sleep is very multifactorial. So do they have good sleep hygiene? Are they eating well? Is the room a good temperature? Are they using too many screens before bed? So we really want to make sure that everything is in a perfect position to allow that oral appliance to work.
This might sound like a little weird, but what's a proper way of breathing? Is there an actual way to breathe properly?
Yes, definitely. I'm glad you asked. So the proper way to breathe is through our nose. We say noses are for breathing and mouths are for eating. We really should not be breathing through our mouth for many reasons. One, the healthiest way is to breathe with our nose and our mouth closed. It filters our air, it warms the air that we take in. It's a much more efficient way to breathe. And mouth breathing also has its own consequences. Not only does it disrupt your oxygen, carbon dioxide in the body, doesn't clean the air that you breathe, but also can have issues with teeth because it can dry out your mouth, and a dry mouth is a big cause of cavities.
Right, absolutely. So it could also be, if we're proper way of breathing is through the nose, what if they've got enlarged adenoids and they have to breathe through their mouth to get that oxygen? How do you differentiate if it's a tongue issue or an adenoid issue?
Great question. That would require imaging, either a cone beam CT in a dental office or doing a scope with a ear, nose, and throat doctor. But exactly like you were saying, getting to the cause of what exactly is causing the apnea is very important.
Yeah, absolutely. Let's dive a little bit into sleep apnea with kids. You mentioned that kids could have sleep apnea and they could be snoring, which is apparently not cute.
Not cute. It's not cute.
So what are sleep disordered breathing in kids?
Right, so you would see that pretty similarly to adults, but with a little bit of a different lens. Definitely if you see that your child is snoring at night, taking deep labored breaths even though they're sleeping, if it looks like they are struggling, if they're grinding their teeth, if they have some shiners under their eyes, waking up unrefreshed, you can just tell that sleep is not a time of rest for them. They seem to be struggling a bit. This could be a sign of sleep apnea. Sometimes kids who are feeling very restless, they could seem like they have a lot of energy, but it's really just them trying to stay awake. So it's important to know if someone is actually getting good rest or is just having a lot of energy to compensate for that.
Interesting. Speaking of energy, I think nowadays the word ADHD has been thrown around a lot, especially with kids who, are a little hyper.
Right, right.
Is there any link between ADHD and sleep apnea?
Yeah, definitely. A very big link. It is shown that about maybe 80% of kids who have sleep apnea also have a concomitant ADHD diagnosis. So they seem to have both on their medical charts.
So which came first?
Great question.
The chicken or the egg?
That's right. In my opinion, based on the research, it's the sleep apnea came first, and I can tell you why. When a child is not breathing well, they're not sleeping well, they wake up tired. Adults, when we are tired, what do? We have coffee to wake us up. What do kids do when they're really tired? You might have seen it in your own kids. They have a big surge of energy. They're bouncing off the walls, and then finally they collapse. But really, it's that big energy ahead of time trying to keep themselves up. And what's the common medication for ADHD? Is Ritalin. Ritalin is really an amphetamine, something to keep that energy going. Why would you give an ADHD kid something to keep their energy going? It's because they don't have energy.
Interesting. Mm-hmm. That's a very interesting point. What about any other infections that are related to sleep apnea, maybe like an ear infection, because that's very common for kids?
Yeah, ear infections are really common for kids. It's something to look into. If a child is getting a lot of recurring ear infections, if they have to place ear tubes, it could be related to sleep apnea. Why is that? Because again, it goes back to how big is this space here? How big is our lower face? If we don't have proper space there, if we're not using our tongue properly and fluid gets accumulated in our Eustachian tubes, which is the tubes that lead out to our ears, that stagnation of fluid can cause ear infections.
Interesting. Okay. So humans used to have straight teeth.
Yes.
Is this a new thing, just like cavities?
Yes. So if you look at ancient skulls, you can see that the teeth were straight and our wisdom teeth fit. It's really in our, evolution here of changing what we eat, softer foods, more easy to eat foods, fewer instances of breastfeeding, that our wisdom teeth aren't fitting anymore, our jaws are getting smaller. But ideally, nature has set things up for us that our teeth should fit in our mouth in a relatively straight fashion.
Interesting, yeah. That's a very, very interesting point, because also with animals, let's say if we talk about cavities, animals don't get cavities. They get gum disease, but they don't get cavities. That's just a human thing.
That's right. Yes. So ancient skulls did show gum disease, but not cavities. That's right.
So if you're not breathing properly, could that being that it can change your teeth? Could it change your face, like how your face gets?
Yes. So it's what has been traditionally called an adenoid face, kind of what you were saying. If you have enlarged adenoids, you can't breathe through your nose, you're breathing through your mouth. That breathing through our mouth can change our faces to what they call like more long face. Our jaws get more set back. And why is that? Our natural position for breathing, like we mentioned, through the nose, but also the mouth, the tongue up against the roof of the mouth. And that pressure of the tongue allows us to develop our jaws in a nice wide fashion. If we're breathing through our mouth, our tongue is set low. And so when we're growing long ways, not wide ways. And again, that can lead to our jaw setting more back and could lead to more, it continues to feed itself into more apnea risk factors.
Yeah, it sounds like a negative feedback loop that just keeps getting worse and worse. Would the patient end up being like hyperdivergent? Or is that unrelated when we're talking about ortho?
Oh, yes, it could be, exactly. Hyperdivergent, having a more of an angle backwards, because the body needs to grow, right? It just depends where we are allowing it to grow. So if it's not allowed to grow up and out, it's going to grow down and back.
Interesting. So let's say somebody's listening to this and obviously they've got kids of their own. How can they avoid that for their kids? And what do they have to keep an eye out for?
Yeah, so many things to keep an eye out for. Again, if your child is constantly mouth breathing, just closing it a little bit for them. Ancient Native Americans used to really, even in their own wisdom, knew that breathing through the nose was very important. And so there are records of moms closing the baby's mouth when they're sleeping, just to get them used to having the tongue up against the roof of the mouth. So we want to make sure that they're not breathing through the mouth. We want to make sure that they're not snoring, making sure that they in general look pretty well rested, and checking for tongue ties too.
Well, what's a tongue tie?
So a tongue tie, when we are developing in utero, we have kind of like, if you can think about webbed fingers, right? So when we are developing, we have some webbing, extra tissue, and then as we develop, that webbing or that extra tissue goes away for us to function. So you can think about it, if a child is born with kind of webbing, that's also kind of what a tongue tie is, when that extra tissue did not dissolve. And there are some genetic factors there. But why do we care? Just as you can imagine, if you have webbing in your fingers, you can't use them to their full advantage. So same thing, if we have a tongue tie, that tongue is not able to sit up against the roof of the mouth. It's not able to properly latch to take out breast milk, and there could be conditions related to that.
Wow. I heard that you had a similar experience in your own family with tongue ties.
Yes.
So it brings me to the question, how early can we release a tongue tie?
Yes, I personally released my son's tongue tie at day 2. We left the hospital, put him in the car seat, and we went to the office. Because I acknowledged the importance of it. He wasn't latching well, even in the hospital. I knew that this would be important for his jaw development, and for proper breastfeeding. Really, a lot of symptoms can come from not having a tongue tie. Colic, not being able to speak well when you're a little bit older, needing speech therapy. And of course, the biggest thing, not being able to latch well, and all the things that come from that.
Oh yeah, absolutely. Yeah, my son had a tongue tie too, and we had to get that done. So if my son has it, well, what are some treatment options?
Sure. So depending where you live, different practitioners may offer different options. One option is with an ENT, ear, nose, and throat doctor. They'll probably use scissors to clip. My personal favorite, maybe biased, is working with a dentist who knows how to treat tongue ties and using a laser. Why a laser over a scissor with an ENT? A couple different reasons. An ENT will probably put the child to sleep under general anesthesia, and the scissor may cause some bleeding or not a full cut. When you use a laser, which is a really wonderful piece of technology, as I'm sure you know, it allows the child to be awake. The procedure is relatively quick, and it can cut more thoroughly without a lot of bleeding. So those are kind of the two options, but really just removing it.
Yeah, and I guess also post-operative pain, right? There has been studies that showed that also in terms of pain, and after the surgery, there was way more comfort or quality of life after lasers than doing a traditional scalpel or scissors.
That's right. Yes.
So how can I help my son breathe better? Like, what are some things that I can do for him?
Sure. So again, really kind of depends on what is inhibiting the growth. What is causing the child to not breathe well? Where is the blockage? Is it the tongue tie? Is it the mouth breathing? Is it everything at once? There are some things that we offer now in dentistry, and we really recommend starting early. I think we are throwing away the idea that orthodontics should start when all the adult teeth come in, because that doesn't allow us to work with the jaw growth. By that time, you're removing teeth to make things fit, and you're not really focusing on a biologically healthy jaw. So some things that we look into is early orthodontics, giving that chance for that mouth to grow, like I said, in a nice wide fashion to allow all those teeth to come in, to allow the nose space to get bigger for breathing, or myofunctional therapy.
How early are we talking about when we talk about orthodontics?
Yeah, so we recommend an evaluation before 6 years old. Okay. Always. I have some patients that I have treated for orthodontics as young as 3 years old.
Wow, 3.
If they're symptomatic and they can't breathe well, 80% of the brain is developed by age 3. It's really not something that we want to wait for if we're talking about oxygen into a developing brain.
Absolutely, yeah. You mentioned myofunctional therapy. What is that exactly?
Myofunctional therapy, I like to describe it as physical therapy for the muscles of the mouth. Myofunctional therapy teaches an adult or a child how to breathe properly, so keeping the mouth closed, tongue against the roof of the mouth, how to swallow properly so you're not getting a lot of air. We might find a lot of people might complain that they feel very bloated after eating. It's because they're not using their tongue properly and they're swallowing too much air. So that's an important part of myofunctional therapy, keeping the mouth closed, keeping the tongue in the right place, and all of that helps to develop the mouth. Why? Because the muscles of the mouth are nature's orthodontics. Muscle can be very strong. It moves things into certain places. If your tongue is in the right place, again, it helps to develop things in a wide sense. If your mouth is closed, it helps to bring those front teeth in the right place versus flaring out. So if all of this is stable and happy, then we can work towards a well-developed arch form.
Yeah, wow. That's extremely important. We touched on the topic of grinding your teeth. We get a lot of patients that say, "Doc, I got TMJ."
Sure. What is that?
We all know what TMJ is, but explain what a TMJ actually is.
Right. So it's very common that patients will say, "I have TMJ," and I say, "Great, I do too."
Right. That's exactly my response too.
Everyone has one. But the reason is because in our medical terminology, the temporomandibular joint, the J part of it, is a joint. We all have it. But patients are usually trying to express that they have TMD, which is a temporomandibular disorder, that they're having either muscle or joint pain in this area, in the mouth area.
Okay, and how can you differentiate between an actual true joint issue versus a muscular issue?
Right, so that usually comes with an exam, doing a full thorough exam, checking function, or how far are they opening, do they open left to right, do any of the muscles bother them, and we go beyond just the muscles around the cheek. You have to look at all of the muscles that we use for eating, called the muscle of mastication. We're looking up here, the temporalis bones, we're even looking at the muscles of the neck, of the shoulders, and finding, are there any areas of tension or compensation that could be related to these TMD.
Yeah. Speaking of back, I have my chiropractor. She does a lot of TMD.
Yes.
Where she does like some needling in the masseters and the trapezoidal area, which really helps with TMD, and patients are learning how. She's referring me patients, I'm referring her patients.
That's amazing.
It's extremely important, especially the myofascial aspect of it.
Yes.
So what are some signs of TMD if somebody's listening to this being like, okay, I think I have this, well, what is it?
Sure. So yeah, exactly like you were saying, TMD is very really requires a whole team to fix. Some things that we would be looking at, which is tricky because we're looking for the proper diagnosis. I feel like sometimes patients with TMD are going to a lot of different doctors and not knowing exactly where to pinpoint it. Because a common one, for example, is headaches. So it may not be that your jaw is actually hurting you, but you might be feeling headaches and not realizing that it could be coming from the jaw. So we're calling referred pain or radiating pain. So headache is a big problem there. And then, it could also be from, we could have breaking teeth, chipping teeth, so grinding in that sense as well. Shoulder tension, neck tension. We always think about, who is the weakest link, and that's where you're going to see the symptoms. It could be that teeth chipped. It could be that you're getting gum disease. It could be that you're having headaches. It really just depends.
Right. Something's got to give.
Exactly.
I say the same thing as a prosthodontist. It's like, something's got to give. It's either the tooth is going to get loose, or the tooth is going to break, or if it's a crown, that something's going to chip. Something's got to give if you don't solve the issue. So that's a very, very, very good point. So what happens if it remains untreated? I think we touched on that a little bit.
Right, yeah. You could break your teeth.
Yeah.
You could be living with headaches when really it could be a very simple fix. Not simple in the technicalities of it, but in the diagnosis of it and further treatment of it. Some of those headaches can be really bothersome for patients and really affect their quality of life. Having your teeth break every time you go visit the dentist and getting new crowns could definitely be affecting quality of life. So it's really good to get on top of that.
Yeah, absolutely. So should I be using my night guard to protect my teeth?
Yeah, great question. As you've probably guessed by now, I really like focusing on root cause. I like to describe a night guard like you are banging your head against the wall, and I let you keep doing that, but I'm going to put a helmet on instead. So you can keep grinding your teeth, but here I'll give you something to protect those teeth, but you're still doing it.
Right.
If there is a cause for teeth grinding that we can address, that's always great. For example, some medical reasons for teeth grinding could be low iron. So having RLS or like restless leg syndrome at night, I always ask my patients about that. If they're having these like shaky, creepy, crawly legs, it could be low iron, and they're also doing that with their jaw. So that could help. Sleep apnea, like I said, could also be related to grinding teeth at night, stress. So we just really want to get the whole picture before protecting teeth.
Right, yeah. It drives me crazy. I do treat some TMD, and whenever I tell a patient, hey, I think I'm going to need to make you an occlusal guard, and they're always like, oh, my other dentist made me one, but it didn't work.
Right.
And then I ask them, please bring me that occlusal guard.
Right.
And it just ends up being a vacuum on top of the teeth.
Right.
With no mutually protected occlusion.
Right.
It's not a hard splint. It's not a soft splint. It's nothing. It's a retainer.
Right.
It's an orthodontic retainer.
Right,
But
yeah.
some dentists call that an occlusal guard.
Right,
Which
just-
is absolutely ridiculous. It actually will create more interferences and make the issue even worse.
Yeah, I've had a lot of
Absolutely ridiculous.
patients who say, I've used a guard, but it's worse. Well,
Yeah.
sometimes your body, if it's too soft or something, uses like a chew toy.
Right,
You know?
right.
Yeah.
You end up grinding more because you're like, oh, this is fun.
Yes, exactly.
Okay, so we talked a little bit about the muscles and hyperactivity of muscles.
Yeah.
Does Botox play a role in all of this? Would that help?
Sometimes I'm very careful with Botox because I want to make sure, again, that grinding is not an alarm system for the body. So like I mentioned before, sometimes grinding is could be really linked to sleep apnea. So if we are just telling those muscles, please be quiet, we're going to put Botox.
Chill.
Yes, you don't want to listen to what you are saying. The body's trying to give us signals. And so I'm very careful about just silencing them with Botox unless I'm absolutely sure that there are no other reasons or whole body effects to that grinding.
Interesting. I did read an article recently that talked about a potential, unproven, but a potential link between resorption of the condyles and Botox in
wow.
the masseter.
Wow.
It hasn't been proven, so don't take my word for it, but I think there's some research going on that to see if there's an actual association. So yeah, we definitely do it. I do recommend Botox for some of my patients, but like you said,
have to rule everything
weigh the
out.
pros and cons. Yeah,
Yes.
to see how helpful that could be.
Absolutely.
All right. So let's conclude. Where are you practicing right now?
Yeah, so patients can find me at the Albahri Dental Center in Abu Dhabi, where I practice.
Okay, and I know that you practice in the U.S. as well, right?
Yes, I also practice in the Boston area in Massachusetts.
Nice. How do you do this?
Back and forth.
How do you do this? Tell me your ways.
with a lot of organization and a good support system.
That's amazing. That's amazing. I'm sure you have your year planned ahead all the time.
That's right.
That's amazing. All right, how are you liking working? You're relatively new with Albahri Dental.
Yes.
How's it been so far?
It's been wonderful. Really enjoy working at the Albahri Dental Center, really because of the quality of providers that they have. All of the dentists are really skilled in their profession. They work together integratively to get the best results for their patients.
Awesome. And going back to your book, where can somebody, if somebody's interested in learning more, how can we get a hold of it?
So this book, it's available on Amazon to purchase.
Amazon.
Yeah,
Amazing.
you can get it online.
Okay,
Yeah.
all right, that's amazing. All right, we'll put the link down. So that concludes our session. Again, we are board certified clinicians. We are not your doctor, but you can come visit us if you have any questions. Everything that we talked about has been evidence-based. That research had been proven through peer-reviewed journals, and we'll obviously link everything at the bottom for anybody who wants to have some more information. And I think everybody now knows where to find you. So thank you for having this conversation with us. I think
Thanks
this was a lot
me.
of fun.
Yes, it was. Thank you.
You're very welcome.